mystery cases and are being investigated by our public health team. Just 25 of those were in isolation for the entirety of their infectious period. So that is a very significant challenge. That makes today a bad day. Now, I've no restriction announcements to make, no rule changes to make today, but I can't rule that out. Ministers and public health officials will be sitting down this afternoon, this evening and into tomorrow, determining whether there's any more that we can do in terms of rules and settings to try and pull this up. Earlier in the week we talked about being at a tipping point. This is very, very serious indeed. Now, I want to just map out for people what's involved if this gets away from us. Hundreds and hundreds of cases every day, and hundreds, indeed, potentially thousands of people in hospital. And anyone who cares to go and interview a nurse in Sydney working in a COVID ward will be told stories that they will never forget. If you can't find one of them, I'll find you a nurse from a COVID ward from Melbourne last year, and they will tell you stories that you will never, ever forget. We cannot allow this to get away from us. We all have to work as hard as we can. Now, the government is playing its part. We locked down early. Couldn't have gone any earlier. We've locked down hard, and we've been criticised for that by some, but we are following the advice. But rules are only as good as the behaviour and the choices that each of us make. I can't be any clearer with the people of Melbourne and more broadly the people of Victoria. If we have a weekend this weekend like last weekend, well then next week it will be like Sydney. Simple as that. This will get away from us. We've got too many mystery cases out there. We need people to come forward and get tested when they have symptoms. Not a day later, not 3 days later, but when you register those symptoms. We need people to follow the rules. And genuinely, stay at home means stay at home. It's not about looking for every loophole, every exemption, every sort of blind corner where people can't see you to do the wrong thing. I get sent lots of stories from lots of different people. You know, there's a whole bunch of people down the Ryback Beach last night who thought the best thing to do was to go and watch the sunset. I'm sure it was a beautiful sunset, but that's not in the spirit or in the letter of these rules. I was out for a walk with Kath last night, within the curfew, within the 5Ks, wearing a mask. A lot of people out weren't wearing a mask. We all have to make choices that recognise how serious this is. There are 700 kids that have got COVID in New South Wales. There are kids that are in hospital in New South Wales that have got COVID. No children in our country are vaccinated. As a parent to every other parent, that should be motivation enough. We can't be certain what the impacts of this virus are on kids. We have got a substantial number of kids infected ourselves in this outbreak. It is spreading amongst younger people, and it will continue to do that unless we all play our part. Now, I don't like having to speak to Victorians like this. I wish we were not in as serious a situation as we are. But these cases, there are too many of them, and there are too many that have been out in the community for too long with infection, during their infectious period, I mean. And there are too many cases, the source of which, the chain of transmission, is not clear to us. They are genuine mysteries. And what we know for certain is that if we have another weekend where people think it's over because they want it to be over, think the rules don't apply to them, it's someone else's job to follow the rules, well then this will spread and it will fundamentally get away from us. It will fundamentally get away from all of us. And we will all pay a price for that. I know this is hard. I know everyone wants it to be over. I know that. I understand that. But it isn't. Our contact tracers are chasing harder and faster than they ever have. We have locked down faster and perhaps in some respects harder than we ever have. It's now up to every single Victorian to make the best possible choices to follow these rules so that we don't get overrun with cases, so that we aren't locked in till potentially the end of the year, and so that our nurses are not having to deal with hundreds and hundreds and hundreds of patients who need a machine to breathe. That's what we're up against here. It's Delta variant. You know, this didn't start in Melbourne. It came from Sydney, but it must be resolved here in Melbourne. We don't get to We don't get to ignore it. We don't get to pretend that because we want it to be done and dusted, it is. It frankly isn't. So, I am in better news. I am pleased to say nearly 50,000 people were tested yesterday. We got their results overnight, 48,273. We have only 15 people in hospital. That's still very challenging for them, but that number is manageable. 6 of those are in ICU and only 1 person is on a ventilator. Those numbers will not remain as low as that if this gets away from us. Beyond that, there were 28,601 vaccinations administered yesterday in our state clinics, and I thank all of those nearly 30,000 people who made an appointment, kept their appointment, turned up and got the jab. That's such an important thing for you to do, and I thank you. There are appointments open as we speak. Thousands of them. Thousands. If you go to the website, you can book, and you can book with confidence. The announcements made in relation to Pfizer at the end of the month, we'll have more to say about that as we get closer to the end of the month, when we know when those supplies are coming and when bookings will open. We'll announce that as soon as we possibly can. But there are vaccination appointments for both Pfizer and AstraZeneca available right now. So please go and book with confidence and then turn up for those important appointments. Beyond that, the Acting Chief Health Officer will make some announcements in relation, make some comments in relation to a breakdown of cases. But it's not just delicate, it's not a tipping point. Like, we are right on the edge of this getting away from us. And it's not because contact tracing aren't doing everything they can, they are. It's not because we didn't lock down fast enough, we did. It's this Delta variant is so wildly infectious that it will find every breach of every rule, and it will potentially spread because of that. So I am imploring Melburnians and Victorians, I am asking you, in your own interests and the interests of all Victorians, we cannot have a weekend this weekend like last weekend. We must all follow these rules and find it within ourselves to push through this. I know it's incredibly difficult, but so too is having thousands of people in hospital, and that's what we are faced with. That is what we will all confront. And I again make the point, it will not just be COVID patients. Others who need urgent care will miss out because the hospitals will be full of COVID patients. So, pleasingly, we know that we can do this. We can find it within ourselves to get through this and to keep these numbers low and perhaps drive them even lower. But it won't happen by accident, and it won't happen because of things that other people do. It'll only happen if each of us play that part. And that's what this weekend and beyond has got to be about. Not waiting for somebody else to do the job for us. It's all of us playing a part in avoiding what Sydney is going through at the moment. We don't want that here. We've had it before, but not with Delta. And if we get it again, then it will mean that kids will get this. People of all ages will get this. People who are fit and healthy will finish up in hospital, and people will die. And not someone you've never heard of, and not someone who was in the twilight of their life, but people who are otherwise healthy. That's what's at stake here. If I had another choice, if there was another way, if I had a warehouse full of vaccines, I don't have any of those options. So all I can do is ask Victorians to follow these rules and not see these case numbers spiral. We're confident that if we do all play our part, we can keep this at low levels and drive it down further. But that's not even the question today. The question really is, do we spiral out of control or don't we? And that is a question that only every Victorian through the choices they make and the actions, their own actions, can answer that question. All of us must answer that question in the way we behave and the choices we make this weekend and indeed beyond. Now, as you well know, I am not one to walk away from media conferences, and I won't do that today, but I do have to go at about 12:30 to National Cabinet. I think you would understand that I need to be at that meeting. So I don't know how you want to do this. Do you want to hear from others, or do you want to ask me some questions? Or I'm in your hands.
You talk about other options to go, I guess, harder with lockdown. What options do you have left?
Rich, there are always further options. I don't want to get into guessing games today, and I'm not going to do rule in and rule out. I know why you asked the question, perfectly legitimate. Those decisions have not been made. But we can't have this accumulation of mystery cases day on day. We can't have an accumulation of people who have been out and about and infectious. I'm not blaming them, it's just the way it's unfolded. We can't have that. So if you've got symptoms, get tested and do it as a matter of urgency. This is urgent. It's not something that can be put off. It's not something that can be ignored. You've got to go and get tested as soon as you register those symptoms. And the good news is we'll support you if you're a day's pay down because you're isolated to wait for the results. And what's more, we'll get you your results the next day. The numbers are in the high 90%, 98, 99% of results the following day. So our labs are working incredibly hard. This is a key point. The lab technicians, they work and for every single case. They work and they do their job. The contact tracers chase every single case. They don't ignore a case because they feel like it. They have to do their job diligently, and all of us have to play our part diligently. None of us get a leave pass from any of these rules. We've got to follow them, otherwise the cases are going to get away from us.
Is the regional lockdown on the cards?
Nothing is ruled out. Nothing. Shepparton, we have a case there. We've got some wastewater detects across regional Victoria. Jerome can speak to that, but we are asking people in Shepparton to come forward and get tested. And I just remind you, the Shepparton community did such an amazing job last year, came out in force and got tested, and we were able to run that outbreak to ground. We've got every chance of doing that again. There are, I think, now 3 testing sites. Extras are being stood up throughout the course of today. And I know that the people of the Golden Valley will absolutely step up and get tested, just like they did last year.
Premier, you put in a plea, clearly pleading with Victorians to stay home this weekend. Will you, I guess, respond to that by having more police on the beat this weekend, a bit more enforcement?
Well, be in no doubt, the Chief Commissioner has made it very clear that through the different operations that police have underway, there will be police right across the state enforcing these rules. And the fines are substantial. I don't want to be fining anyone. I don't want any penalties to be issued. I don't even want warnings to be issued. And on the point of warnings, the Chief Commissioner has been very clear. The time for warnings is over. People know these rules. We've been living under them for a very, very long time. We know that it's tiresome, it hurts, it's painful. We wish it was over. It's not. So it's what we're doing now, redoubling our efforts, being even more conscientious, each of us in the choices we make, or we will be like Sydney. And I'll be standing here reporting hundreds of cases, and I'll be reporting deaths. And we all have to work very hard to avoid that. And it is possible. It is possible for us to avoid that, but only if we make good choices.
Premier, there's a freedom rally organised for tomorrow. Lots of people may be attending that. Do you have a message for people who might be attending that?
Chief Commissioner sent a very powerful message yesterday. I'll just remind you what he said yesterday. There are penalties, that's against the law, and Victoria Police will take action.
Premier, a number of cases in schools and in young children. Obviously, there are a number of very worried parents. If we do see further restrictions, is it likely that childcare centres will be closed?
As I said, nothing is off the table. I can't rule out making further changes in a whole range of different areas. We will. And look, and I hope you would credit me with the fact that when we've made decisions, we've been pretty quick to announce them. No decisions have been made, but I am being very clear with people. Despite the lengths we've gone to, despite the speed with which we acted, there was no delay. We didn't hesitate. We didn't try and do this in one part of Melbourne. We've done it across Melbourne and across the whole state. But the rules are only as good as the effort everyone puts into following them. So I can't rule that out, no.
Do you have advice that the situation is actually much worse than it appears in the numbers today?
Oh, look, I think, Rich, all the way I look... No, I don't have advice to that end. But the point I would make, well, I have no such advice, but what I would say to you is there's always more cases out there than you know about, because not everyone gets tested. Not everyone gets tested as soon as they register symptoms, and there'll be some people who will have had symptoms and will never have got tested. So you've always got to assume that it's out there somewhere. But short of a permanent lockdown, which we do not want, then it's never zero risk. You're always managing some level of risk. What we know and can be absolutely certain of is that if we continue to see these numbers over coming days and into next week, then it will be incredibly difficult to pull this up. Incredibly difficult. And then once it's away, you just look at Sydney. Just look what's happening in Sydney. We do not want that here. We have a chance to avoid that. But it's not a matter of passing a law. It's not a matter of giving a speech. It's not a matter of anger and frustration. None of that works against this. It's only thousands, indeed millions, of individual choices that each of us make tonight, tomorrow, Sunday. Sneaking to a mate's place, going out and not wearing your mask, or wearing your mask and not wearing it properly, having people to your home. The list goes on and on. We know all about this. The result of of any bad choices that are made will just mean hundreds of people in hospital.
So is it...
Simple as that. And it's not pleasant to be in hospital with this. And there's also more than a few unanswered questions about what this means for kids. So as a parent, I just say to people, no children are vaccinated in our country. That should be enough of a motivation for us all to work as hard as we can to stop kids getting this. And if that's scary, well, it should be, because it is. We don't know. We don't know what this does in the longer term. We should all be motivated to limit the spread of this.
Premier,
Only following the rules will achieve that.
Premier, in every other lockdown we've seen case numbers driven down almost immediately. So what do you think's going wrong this time around? Do you think lockdown fatigue is to blame here?
Well, there's the Delta was one issue. You only need a handful of mystery cases, and then you've got those mysteries that then multiply, and they're not multiplying every 3 days. Like, the attack rate of this thing is quite amazing. You know, it is highly, highly infectious. Now, is it unbeatable? No, I don't think that's the case. Is it a massive challenge and a bigger one than we've faced before? Yes. But do we have this live choice between going the way Sydney has, and that's not a sense of criticism, I'm just using that as the most contemporary example, or do we contain this? And then once it's contained, then we can all work to drive the numbers down. That is still within our reach. But so too is deteriorating to the point where Sydney is. And then it's gone. And then the only choice you've got is to vaccinate your way out of it. And I'm telling you, the vaccines aren't here.
Is it like
I don't have the vaccines. If I had them, then they'd be in arms by now. And that's not a sense of criticism, it's just a fact. So we all have to not focus on what we'd like to be the case, because we'd all like it to be over. We've got to focus on the actual realities we face. This is deadly. It will overrun our hospitals, and once it gets away from us, there'll be no putting it back in the box. It'll be like Sydney, and we don't want that.
Is it likely our lockdown will last even longer?
You keep saying there's no vaccines, not enough vaccines, but AstraZeneca's being pumped out of Broadmeadows, every day.
And no state's done more to push AstraZeneca than us.
Shouldn't we be saying that,
the best vaccine, Rich, is the one you can get today. And yesterday I announced that both these vaccines have been through rigorous processes that stand up to any and all international scrutiny. Right? There's been a target advice provided, but there is a way to make an informed decision to access AZ or to access Pfizer. Yesterday I reported that there were 14,000 Pfizer appointments that were unfilled. That's just in state clinics. And 12,000 AstraZeneca appointments unfilled over the next week. Those numbers will have come down a bit because we talked about it. I just again send a message. If you want to do something about this, if your sense of frustration motivates you, as it does I think for so many Victorians, make an appointment. Make an appointment, book with confidence, go get your first shot, then get your second, and you will have made a massive contribution to us getting to the 80% and then being in a different set of rules, a different way of life, in fact.
So if
Was the PM's
AstraZeneca...
announcement yesterday about Pfizer being available for people under 40 from August 30, was that helpful given the amount of people under 40 that have AstraZeneca bookings for next week?
Well, I just say to people, I wouldn't be not showing up for a vaccine. If you've got a vaccination appointment, then turn up and get it. I wouldn't be banking on anything being here in 2 weeks. Like, I haven't seen that stock. Is it even here? I hope that by the end of the month, 16 to 39-year-olds can get Pfizer. I don't know whether they'll be able to.
Did you have a heads up that was coming?
No. And I just say to people, please don't cancel a booking. Please don't be a no-show. Please honour the booking you've made. Or if you haven't made a booking, there are spots available. Please make a booking, come forward, we'll get you through as quickly as possible. If you need to sit down and talk to a senior nurse or a pharmacist or a doctor about your circumstances, you can do that and make an informed choice. As the Chief Health Officer has said, and as logic tells you, the best vaccine is the one you can get today.
So you've been given no
and there
indication.
are appointments available.
You've been given no indication that there will be enough Pfizer come 30th of August to cater for that age group?
No, what I'm saying is there's been an announcement about eligibility. I don't know about you, Julia, but I don't think... can you make a booking? You're in that age group. The bookings aren't open. Why aren't the bookings open? I don't know. You need to speak to the PM about that. Announcements were made yesterday. And the federal government's entitled to make announcements, but I'm also entitled to point out the facts. You can't make a booking for this stuff. I haven't seen it. Is it sitting in a warehouse? Is it arriving on a big military plane? I don't know. I'm just saying to people, for heaven's sake, don't cancel an appointment you've made now off a promise that something's going to be available in 2 weeks' time. We need, all of us, with a sense of urgency, to do everything we can to limit the spread, and getting vaccinated does that. That's the only point I'm making. I'm certainly not barracking for the stuff not to be here. I'd like it to be here, and I'd like it to be here in record supply. Then we can get people vaccinated.
Premier, the New South Wales government has flagged so-called freedom once the state reaches 70% vaccination rate for people who can prove that they are double vaxxed. Are we looking at a similar system here in Victoria?
That's not the national plan. I'm not sure whether that's an interpretation of what's been said. There are some rules that change at 70%, but I wouldn't be using that kind of language. 80% is where we're at. If 70% was the right number, then we all will have, then Doherty would have come forward with 70. They didn't. Some things can be eased at 70, but 80% is the real game changer number.
Sorry, just on that question, what are those things that can ease at 70%?
Well, there's a very large placemat that the Prime Minister's held up and shown you. I can get you a copy of it. I haven't got it in front of me now. But there are some changes that are made.
2 weeks into these
For
measures,
instance, lockdowns are less likely, much less likely. They're not impossible, but they're less likely. At 80%, they're highly unlikely. There's also some work that's being done about whether there are some rules that might apply and some restrictions that might apply to those who have not been vaccinated, because that's where the problem will be. That's where the pandemic of the unvaccinated will be. It'll be amongst people that haven't had a jab.
Premier, we're 2 weeks into these.
Working on something with Tasmania and Northern Territory, put forward that draft plan to National Cabinet last week. What might that look like? If you're saying that New South Wales plan to open up at 70% is not a good one, what I'm
saying to you is the Premier of New South Wales has been consistently supportive of the national plan. So I've not heard her say anything. Now, easing at 60 or 70 is not the same as opening up at 60 or 70. So I don't want to play word games, and I don't know exactly what you're quoting, and I didn't see her press conference today. She may have added to other things she said, but as of right now, everyone is committed. Every leader in the country, regardless of what political party they're from, is committed to that national plan. And there are some changes at 70, but the big step changes come at 80%. And the only way we get to that is if people go online, make one of those bookings, turn up for your appointment, and protect yourself and indeed protect everybody.
For us here in Victoria, though, we're 2 weeks into the hard lockdown measures, as you're calling them. The figures today are obviously no good, as you've run through. We've got 2 more weeks to go.
Yes.
What are we shooting for? What's considered contained? Because it can't be zero anymore. Do you concede, I suppose, we have to live with this in some way, shape or form?
No, I don't concede that at all. But whether there are cases, as I said yesterday, case numbers are less a challenge. It's the story that sits behind them. We can have numbers, but if they've been tucked away in isolation for all of their infectious period, or even a very substantial part of their infectious period, then their risk profile is very different. Their risk to all of us is much different than cases that have been out and about, and that's what confronts us today. Cases we can't link, and cases who've been out and about through no fault of their own. We're not blaming them, we're just making the point. You've got to get tested as soon as you register symptoms. Otherwise you may be unknowingly. You defer going and get the test, you go about your business, and you may well be infecting a whole lot of other people you love, people you've never met. All in all, this is not a good thing to have, and it's certainly not a good thing to give to anyone, because what we know is that if it spreads further and further and further, it gets away from you, you can't pull it up, and then it's no longer about numbers of cases, it's about numbers of people in hospital and the number of funerals that we're going to be planning. That's where it gets to, and it gets there really fast, which is why choices that are made by every single Victorian this weekend will be critical.
So after 2 weeks of restrictions, though, for us to be in this position today with these numbers, are you saying people are getting sick because they aren't sticking to our rules?
Well, what I'm saying is that we have more cases out there than we would like. We have unlinked cases, and I think that we are tired. We are all tired of this. And if we had a choice, and if we had the luxury of being tired and being fatigued, well then fine, but we don't. So I think there
is the contact tracing behind the cases, though, showing that they're not sticking to the rules?
The contact tracing is showing, and I think look, I'll put it to you this way. I think all of you and everybody on this side of the divide know people who have in recent times potentially not done everything they should have done. We all know that, right? We are tired. We are fatigued. The data, anecdotally, just moving around the community, following the rules, observing others who aren't. It's not about blame. It's not about any of that. It's simply we don't have the luxury to behave that way, unless, of course, we're prepared to do what Sydney's doing now, which is having to treat so many people in hospital and having people die. We can avoid that, but there's only so much contact tracers can do. There's only so much police can do. There's only so much the government can do. There's only so much that the media can do in getting messages out. Ultimately, it all falls down, it all comes back to individual choices, and it falls down if people make bad ones. So I'm just asking people, let's avoid what Sydney's going through by making really good, solid choices this weekend. Stay at home means stay at home. The reasons to leave are well understood. Wearing a mask is not that hard. And, you know, for instance, going and visiting friends is not allowed for the best of reasons.
The restrictions in Sydney, though, Premier, are different to what we're living under here in Victoria. So is it showing that our cases are getting sick because people aren't doing the right thing, or is this a feature of Delta that in some way, shape or form we have to live with?
No. There's no living with this. The notion that we can just let it all run, there is no I've really got to say, it is so unhelpful. I'm not saying you're doing it, but other people, this narrative, oh, well, we'll just have to live with it. If you don't have these restrictions, it will run wild and not enough people are vaccinated. And then the hospitals will be absolutely full to the rafters with people. So this notion that it's just, oh, well, we just, suck it up and we should just live with it. No, that's not an option. That is not an option. As I've said so many times, if me and every other Premier and the Prime Minister and every other health expert in the country had 5 other options or even one other option, we would choose it in a heartbeat. We don't. This is where we're at. Whether we are happy about it or not, yes, it's terribly challenging. But so too is having our hospitals full, and that is what will happen if we don't all make the best choices. Stick together, look out for each other. And the best way to do that is to get vaccinated if you're eligible, go online, make an appointment, get tested if you've got symptoms and follow the rules. Do everything you can, be vigilant in your family. Point out to others that you know who maybe aren't following the rules. Ask them, please, for every reason. I cannot stress enough how close to the edge we are. If we don't all make good choices this weekend, then I'm not going to be reporting 50-something cases here next week. We'll be reporting a lot more than that. And then it will be away from us. And that's not good for anybody. Anybody.
Premier, in Israel, Premier, they've just announced that they've hit the high mark in vaccinations, but Delta is still running through there. Their senior epidemiologist said yesterday that regardless of vaccinations, regardless of the new C24 drug, etc., that they have, that they will have to learn to live with it after the vaccination, and it will be like the flu. I mean, what do you say to that?
Hang on a second. The terms we use and the rules we live under and the freedoms we enjoy when we get to 80% are very, very different. But we're a long way from that. We're a long way from that right now. The last time I looked at Israel, they were not yet at 70%. They've done very well, but they're not yet at 70%. They still have some rules on, and they've had to do all sorts of changes because they've seen it, tear through the unvaccinated community. But once we get to 80%, then the rules do change, and there is a sense that everyone who can be offered a vaccine has been offered a vaccine. We can only do so much to implore people to come and be part of that program, and we don't lock down, the whole community to protect people who could have got a vaccine and chose not to. I've been very clear about that and been criticised for using that language, but that's the position. But we're a long way from that. So all of our language will change, the rules will change, the way we live our life will change when we get to 80, and hopefully higher than 80%. The other thing too is that, I'm sure National Cabinet today will have a discussion about the fact that the Doherty modelling is based on very low case numbers, not 10,000 active cases in New South Wales, not 300 active cases here in Victoria, not what Victoria will be like in a few weeks' time if people don't follow these rules.
So just to clarify, once we get to 70 or 80%, regardless of the rate of infection of the Delta, we won't be locking down or not locking down the same way we are now?
As the National Plan says, it is highly unlikely that we would be locking down the entire community. If you had a particular localised problem, then you might take localised measures. If you had a particularly vulnerable cohort in the community who had not been vaccinated for whatever reason, there are some people out there who can't get vaccinated. Let's spare a thought for them, and that's why, when and if we move to these passport things, we're going to need a code, if you like, for people who, for medical reasons, can't be part of the vaccine program. Again, all of this is for another time. It's all very important, and I understand why people want to know. But if we want to have this debate properly, we've all got to get vaccinated as fast as possible. And the challenge at the moment is that there's millions of people who want to get vaccinated, and there's not the vaccines right now for them to be in the program. That's going to change soon, though, which is really, really important. But please, no one cancel a booking today or this weekend or next week. Please, if you've made a booking, turn up and get that jab. And if you want to get vaccinated, there are spots available, both Pfizer and AstraZeneca, and you can book with confidence and play your part.
Have you spoken to Danielle Green yet?
No.
Does it help, or you're asking people to stay home, and that an MP from Melbourne is spending her time in Warrnambool?
I answered it yesterday very clearly, and I don't have anything to add.
Premier, can we expect an announcement later today on regional Victoria or Shepparton?
No.
So those businesses in Shepparton should be preparing for the weekend, or?
I'm being as frank as I can be. Nothing's off the table because I'm not doing rule-in, rule-outs. But we'll follow the advice, we'll follow the evidence. The best thing for people in Shepparton to do is to get tested, and I'm confident they will, because they've done it before. They've shown us how to do that. Amazing effort last year. And I'm sure that there's already queues probably at those additional testing sites. That's how keen the Shepparton community, the Golden Valley community will be to do the right thing. I'm very, very confident of that. So it's not about spooking anybody. We're just being clear. We will look today and tonight at what more we can do. But somebody made the point earlier, Rich, maybe. It's not like there's a whole lot of extra tools available to us. Like we have gone pretty hard and we went very quickly. So what that says to you is it's back to compliance. It's back to everybody. And again, let's not look at what occurred yesterday or what can't be changed. Let's look and focus on the decisions we make this afternoon, tonight, into the weekend. Like Sunday, I think is going to be quite a nice day. Yep, at home. At home. Otherwise, it'll be lots of Sundays spent in hospital. That's the fact. That is the choice we have. Either stay at home or lots and lots of people are going to stay in hospital, and some of them won't come out.
Premier, the Northern Territory has opened up vaccination for those over 12. Is that something that we're considering?
We're considering all manner of things, but it's all dependent on how much supply we have. On the additional Pfizer that we have received and are going to receive next week, the Polish stuff, we'll have more to say about that soon. And in relation to how what the PM's announcements yesterday mean in a kind of on-the-ground sense for the 16 to 39 Pfizer from the end of the month, we will, as soon as we've got clarity on that, we'll be making further announcements. Certainly for what it means in our state clinics. I can't make announcements for GPs.
Has the date been decided for the GAT yet?
We will provide certainty to students as soon as we possibly can, and I'd hope that can be very, very soon. The Education Minister, Deputy Premier, is very, very keen and is passionate about providing certainty to students as much as we can, as soon as we can. There's been lots of discussions about this, and we'll update you soon, very, very soon. Any other issues for me? I'm sorry, I don't like leaving without having answered all of your questions, so hopefully I have answered all of your questions.
Are you looking at CD24? They're using it in Greece and Israel as a drug which is shown now.
The best person to talk to you about therapeutics is Ben Cowie, who's here just behind me.
Okay, great.
He's a doctor. He can speak to all of those matters rather than me riffing on that subject. Please, please, please make good choices this weekend. Otherwise, we're going to finish up with lots of people in hospital, and we're going to be planning funerals. And it won't just be people as if it's easy. It's not. It won't just be people in the twilight of their life, though. It'll be otherwise healthy people. Stay at home, or lots of people are going to be staying in hospital, and not all of them will get to leave. That's what we confront here in Victoria, and we are equal to this. We can do this. We've done it before. We've done it before, and we'll do it again. Thanks very much.
So we might have Jerome just give us an update on some of the data, and then the Acting Chief Health Officer, myself and Jerome are happy to take questions.
Thank you, Minister. 57 cases for today, same number as yesterday, but a very different picture that we're seeing unfold today. 55 of those cases are locally acquired community cases. 49 of those are linked. Only 25 were in isolation during their infectious period. Of those cases, 14 are associated with the day 13 testing at Altacor College, and they were all in isolation. 3 were associated with Glenroy West Primary School. That gives us a total of 17. 4 are associated with the Newport Football Club, household contacts within one family and one other person, and 2 associated with the Newport Elite Gym. So that's now 23 in total. We have 4 more cases associated with the Pizza Central at Malvern, and 6 more cases associated with our 2 emerging clusters in St Kilda, one around Fitzroy Street, one in St Kilda East. That takes us to 33. We have 1 more case at 510 Lygon Street, the Carlton Street Towers, primary close contact, and 2 more household contacts of the Altona North case we discussed a day or 2 ago. We also have 1 more case associated with the Doncaster East case we identified yesterday. That appears to be a linking case. We have more work to do around that. That takes us to 37 cases so far for today. We then have 13 cases in 1 cluster at the My Centre Multicultural Youth Centre in Broadmeadows. It's 13 cases all associated with 1 facility. I'll come back to that in a moment. That takes us to 50. We then have a new case, which is a domestic cabin crew member who lives in Tullamarine, who's been involved in some flight movements around Newcastle, South Australia and Queensland during their acquisition period. We have a case in Pakenham. We have a case in Point Cook, who's also associated with the Shits restaurant at Werribee. We have a case in Port Melbourne and a case in Brunswick. That makes up the 57 cases we're reporting today. In addition, this morning we were notified of a case in Shepparton. At this point in time, we have emerging details. It's a male in his 30s. We are testing, of course, his family members at this point in time. Goulburn Valley Health have stepped up testing at the respiratory clinic already in Shepparton, and there's also a pop-up testing site going up at the sports precinct this afternoon, and there'll be a 3rd site going up later on today. I urge anybody in Shepparton, as we start to identify exposure sites, and anybody who's symptomatic in Shepparton, please urgently come and get tested. Shepparton remains, of course, under lower restrictions than Melbourne. It's very important that we identify any possible linkages to this case. We'll have more to say about that over the coming days. We cleared 2,145 primary close contacts yesterday, primarily from Altacor College, Caroline Springs Square and Glenroy West Primary School. That takes to just over 10,000 primary close contacts. So the number of primary close contacts has dropped by 5,000 just over the last few days. That's a testament to the people doing the isolation protocols effectively and clearing their day 13 tests. We're very grateful for them for doing it. But those remaining 10,000 people and all the others we identify over the coming hours and days need to isolate securely. It is so important at this critical point of the outbreak that we maintain control of what we currently have. So the picture of the outbreak as we have it today is that we continue to see strong compliance and strong community and school support during those older parts of the outbreak, where it went through the large schools, through Caroline Springs, through Melton, through Glenroy. That part of the outbreak remains pretty stable, and we thank everybody involved with the isolation protocols that they're undertaking. It is so important they get all the way through to that day 13 test and that clearance process. You have to get to the end and beyond the finishing line. We're still seeing cases emerging in Newport. Newport's been drip-feeding cases over the last few days. We still have some concerns around exposure sites around Tower Power Plus, both at Point Cook and at Point Cook and at Werribee. Also, Newport Footy Club, we're still seeing some household and social contacts emerging from that cluster. It's so important that that group, that community, stays tight and stays tight to its isolation protocols. And around the Elite Gym at Spotswood. Again, a number of people in isolation. I ask you, please, continue those isolation protocols. And if you have any links with the people who are isolating, please keep your distance. The My Centre Multicultural Youth Centre at Broadmeadows, 13 new cases today. We have some possible linkages that we're continuing to explore, but in doing the testing and the contact tracing over the last 24 hours, the earliest case or the earliest onset of symptoms goes all the way back to the 11th of August. It highlights again, if you're symptomatic, come forward immediately for testing. Don't wait a couple of days to see whether those symptoms go away. There's not much seasonal flu around. There's not much seasonal cold around. We need you to get tested if you've got symptoms. I'm glad we found it, but we now have 13 cases in one hit, in one centre, and again, right in the middle of our young people, right in the middle of looking after our youngest, our most important Victorians. We continue to have cases around the Central Pizza at Malvern. That's been around for a couple of days now. We have potential linkages between that site and Altona North through some employees. And I get our stress to essential workers. Essential work is an important thing at this point in time, but the responsibility that we bear as essential workers is to monitor our symptoms urgently. Do not abuse your essential worker status. Only use it for essential work, and keep your distance and isolate properly when you need to. We still have some cases emerging around Lygon Street. There's a big response in our public housing set up there. My thanks to all the residents in 510 and 480 Lygon Street for the work that they're doing and all the testing teams that are working there. We continue to work the two clusters. We've seen a very strong response in the St Kilda area, particularly around Fitzroy Street and around St Kilda East. More cases have emerged, the ones I've reported onto. Again, we please ask any member of the community that's St Kilda area, if you've had those exposures, please come forward and get tested. And we're seeing good testing demand again today. And finally, over the last couple of days, we've now got new cases in Doncaster, in Point Cook, in Pakenham, in Tullamarine, Port Melbourne, Brunswick, and Shepparton. It's getting to the point where it's easier to read out the suburbs where we don't currently have lines of inquiry that are going. It is now so important, as the Premier has said, we've got to stay tight. If you have been asked to isolate because you've been tested, or if you've been asked to isolate because you're a primary close contact, please maintain that isolation protocol all the way through. There's so much support available from us to help you to do that. Please reach out if you need that support. If you have any symptoms whatsoever, get tested. There is no downside to getting tested. Please, it is so important that we identify those remaining chains of transmission that are clearly still out there. And if you're not symptomatic, if you're not a primary close contact, then please stay home. Stay home, sit tight, keep your distance. We've ridden these ones out together before. The next few days are critical to us riding this one out together. I'll hand over to Ben Cowie, our Acting Chief Health Officer.
Thanks, Jerome. So, indeed, this is a really concerning situation. We have multiple outbreaks and cases being diagnosed in suburbs right across metropolitan Melbourne, and as of this morning, also in regional Victoria. 30 out of the 55 cases that Jerome was talking about just then were not in isolation for the duration of their infectious period. So the majority of cases not in isolation, that proportion is going in the wrong direction. That's exactly why we need to limit people moving around and why this current lockdown is really so vital. We have to stop people coming into contact with each other and we need to stop that happening wherever and whenever we can, because that is how the virus is transmitted and that is why the numbers continue to increase. So I ask every Victorian, please follow the restrictions and help us get control of this outbreak as quickly as possible. 49 out of today's 55 cases are linked to known outbreaks and cases. The public health teams at the Department of Health, our local public health units, are literally working through the night to make these connections, to ensure these people are linked to care, and to then follow up their contacts and the contacts of their contacts. Hundreds and hundreds and hundreds of people for every case that's diagnosed. But despite that still leaves us with 6 cases, as Jerome was mentioning, where we simply don't know at this stage where they acquired COVID-19. And that really does worry us immensely. The age profile for the current outbreak is much younger than we've ever seen before, as I mentioned yesterday. And breaking that down by age group, for children aged between 0 and 9 years, we have 89 active cases. So that's 26% of our entire outbreak is children aged under 10. So between the ages of 10 and 19, there are 72 cases. 20 to 39 years, 120 cases. 40 to 59, 56 cases. And for people aged 60 years and over, 12 cases. This is a completely different epidemiological pattern than what we've seen previously. So there has never been a more important time for everybody who is eligible to get vaccinated as soon as possible. If you've already had your first dose, then please book in for your second. It is one of the very limited reasons that you can leave home at the moment. And as the Premier was saying previously, we have over 380,000 available vaccine appointments over the next 4 weeks. And we really need Victorians to come forward, to book in, take those appointments and get us towards those thresholds, that initial 70% goal and then the 80% fully vaccinated goal, which we'll really see, based on the decisions of National Cabinet and the modelling from my colleagues at the Doherty, will see us get to a place where these restrictions are far less severe and far less necessary. So these are really tough times. Getting vaccinated is our one long-term way out of this pandemic. And in addition to giving us back the freedoms that we all crave, it will save so many lives in the process. Vaccination in Victoria is saving lives right now. The age distribution I just went through, the lower proportion of cases in people at the highest risk of losing their lives to COVID-19 demonstrates that the vaccinations being delivered in Victoria right now are saving the lives of Victorians today. That said, we do have active chains of transmission, and we do have people who, through no fault of their own, have been infectious in the community. The mystery cases do give us concern, substantial concern, but our public health team is acting to investigate and to manage and to control these cases as quickly as possible. So this is something all of us in Victoria are dealing with, and echoing both the Premier and Jerome just then, we've all got a role to play in getting through this. That's it for me, and I think we're handing over the questions. Thank you, Minister.
So, being an inadequate replacement for the Premier, we're happy to take questions.
What do we know about this Broadmeadow Youth Centre? And I think you say the 11th of August they first started showing symptoms. What do we know about why it took so long?
Well, I'll get Jerome perhaps to go through that, and I'm sure he'll answer the question.
Thanks, Minister. So we identified a case through our contact tracing team who was associated with the My Centre, Multicultural Youth Centre in Broadmeadows. That led to a whole series of other chains of people that we rapidly picked up yesterday and got tested. One of those individuals who was there for essentially a primary close contact of the first case we identified yesterday had symptom onset going back to the 11th of August. And it highlights again, the virus will always find you, and we will always find the virus. Ultimately, it all pops out. So,
do you know where they picked this up?
Sorry?
Do you have an idea of where this cluster's emerged from?
Well, yeah, no. There are some linkages potentially between this Broadmeadows Centre. There's some overlap with the Glenroy West Primary School community. We do not yet have the direction of flow or the nature of that connection at this point in time. That's the work for us to do today.
You raised some concerns about drifts in Newport area.
Yep.
Is that an indication that not everyone is isolating properly as they should be?
Look, I think we've seen, on the whole, we've seen really good, as I've said earlier, a really good isolation, really good compliance with isolation protocols for those primary close contacts across the vast majority of this outbreak. We are concerned about the number of, as I said, drip feeding cases coming in and around the Newport area. There are some indications that maybe the isolation compliance hasn't been as tight as it needs to be within one or two individuals, and we're really concerned. I mean, that's why I've called out some of those locations today. It is so important. The virus will leak with you if you drop your guard for a moment. If you think, I'm just going to pop out and see my mates, I'm just going to go and take a delivery or whatever else you think you're doing, you can't afford to do that now. If you've been asked to isolate, you must maintain your isolation. And if you're continuing to use venues, do it within the restrictions that are there.
Is anyone being fined for that? Is anyone being fined for that if they're breaching isolation?
Not at this point in time.
And why is that?
Not associated with this outbreak. Look, we will, where we find clear flagrant breaches of isolation, clearly we'll deal with it, but that is not the focus of the conversation today. What we're seeing today is, the 6 mystery cases that I've gone through, 3 or 4 mystery cases again yesterday. It is building a picture that we have chains of transmission that are going wider than we'd like to see, and that this is not something that's in a particular suburb or a particular family or a particular group. This is now something that genuinely impacts all Melburnians, and we really need to step up to it.
That first person just showed symptoms first on the 11th of August. Where did that person get tested?
That person got tested yesterday as part of the group of people that were tested that identified the 13 cases that I've reported today associated with that centre.
So how disappointing is that for authorities that this person's been unwell and out in the community?
Look, it's a huge disappointment to that individual that they're positive. It's a huge disappointment to all of us that we find these cases so late, because it means a longer period of time in the community. The flip side of that is, we are in lockdown at the moment, so that does reduce the number of exposure sites, the number of possible contacts. But again, it's the one thing we can all do. Keep a close eye on our symptoms and get tested immediately. 50,000 people did that yesterday. That's what that testing capacity is out there for. It's the one thing we all need to do to keep ourselves safe.
What's the makeup of that 13 cluster? How many of them are children?
I don't have that makeup with me at the moment, I'm afraid.
And where did the index case get picked up that then that testing's happened beyond that?
Yeah, so the index case presented, they were on our radar as a potential contact around the Glenroy West primary school. We got them tested very quickly, and then it uncovered another net of people that we picked up yesterday.
And that's not the person who's been unwell and symptomatic since the 11th of August?
Different person.
Why were they deemed a potential contact and not?
So they came up in some other inquiries we were making around some of the cases we've seen in recent days. That's how they came to our attention. So that for the avoidance of doubt, they were not an original primary close contact or secondary close contact, but on the ongoing work we've been doing over recent days, we identified a person of interest. That in turn led to the 13 cases we've identified in the numbers today.
And who else makes up that 25, 30 cases that weren't in isolation? Is the fact we're at that number a sign that contact tracing is kind of struggling to keep ahead of?
No, it's not. I think if you look at the nature of this outbreak over the last few days, it's a pretty clear picture. Again, the fantastic work that the public health teams have been doing over the last 2 weeks. That initial outbreak around Hobson's Bay, around Caroline Springs, Melton, all the way across into Glenroy, stable and has on the whole been kept very tight. We've seen a number of cases emerge in recent days around the Peter Central in Malvern, around the 2 clusters within St Kilda, the Doncaster East case, the case up in Brunswick, a number of quite disparate cases. As you then go and contact those, you find more primary close contacts that haven't been in isolation because they've only come onto the radar in the last 2 or 3 days. That's how we get to 25, including, of course, the 6 mystery cases identified today. Julia?
If this infectious person was on the radar, why were they not put into isolation as a precaution?
So, as I said, Julia, we've been doing additional work around some of the cases we've identified in recent days around that part of our northern suburbs. That's how that person came to our attention, and that's why she was tested, and that's how we found the rest of the cluster at this youth centre.
Does this change the game when it comes to transmission? We've been talking about confirmed transmission between kids, whether it be at playgrounds.
Yep.
There's obviously confirmed transmission within this childcare centre. Mm-hmm. Does that bolster an argument that maybe we need to be more careful around childcare centres? Does some need to only be open to essential workers' children? Are we looking at that?
Look, so as the Premier said earlier, look, I think at this stage all options are on the table. Look, we've always wanted to get the right balance between the restrictions that are in place, but we've been concerned about transition between children all the way through this particular outbreak, and Ben's gone through the age profile of what we see today. 26% of everybody who is active is under the age of 9. I mean, this is how this is impacting our very youngest Victorians. So we are concerned. We'll if we need to, and we'll obviously look at the results over the course of today and tomorrow to see what other measures we might need to take.
We've heard reports of a positive police officer at Knox. Do we know where they fit into all of this?
Yeah, so the positive case in Pakenham is a serving Vic Pol member who's worked in Knox and Lilydale.
And how many officers or members from that station are in isolation?
I don't have that number yet. So obviously we're working, this case popped fairly late yesterday, so we're obviously working with our colleagues in VicPol and the individual concerned to identify the contacts they've worked with. I know VicPol have very strong workforce arrangements, so we're confident we can identify that pretty quickly today.
Do you have a sense of how ill these young people are? Is there, I mean, you're saying that they're infected, but are they in hospital? Are they getting
We've certainly seen during the course of the last 2 weeks, we have seen a child in ICU, not ventilated, but we have seen a child in ICU. At this point in time, to the best of my knowledge, no children are in hospital. But again, with this virus, it moves quickly, as we've seen not only here, as we're also seeing on the other side of the Murray.
With those kids, the cases in kids under 9, are we seeing them then pass the virus on to adults?
Yes.
Or does it stop with them?
Yeah, we've seen every direction of transmission between children in this particular cohort. So we've seen children transmitting at school between each other. We've seen transmission from teachers to children. We've seen transmission from children to adults, particularly within a household. And we've seen transition between children playing outside. All those scenarios have eventuated in this outbreak today.
Have you seen any more cases from that engagement party? Is that part of that St Kilda East?
There are, of the 6 cases I've reported today in St Kilda, 2 are associated with the Fitzroy Street end of the St Kilda cluster. 4 are associated with the St Kilda East cluster. Again, those social contacts that we've been talking about over the last few days.
But is that the engagement party?
I'm not sure which particular social gathering they came with, but my focus now is on, I believe 11 cases in that St Kilda East cluster in total. That's come through through a range of both social contacts that we'd rather had not taken place, as well as normal household contacts that are quite legitimate. And I expect to see that cluster continue to grow over the coming days. Of course, because they're primary close contacts, if they're in isolation, we are less concerned. The concern of today and the urgency you're hearing today is the sheer number of cases that are both not in isolation, because they've come to light fairly recently over the last few days, and new mystery cases today, new mystery cases yesterday.
On the St Kilda area cluster, the homeless woman, sex worker from earlier this week, was there a period where contact tracers didn't know where she was? Just say.
No, there was certainly of 2 individuals that were identified in the sort of Fitzroy Street area. They originally presented to the ED at one of our major hospitals. That's where they were identified and tested. One of those individuals did go AWOL for a little time, but came back to the ED and has since then been securely cared for.
And do you know where she was
hours.
in that hours?
Short hours.
And do you know have you tracked where she was in that time?
We have. She's been look, becoming. Nobody wants to be COVID positive. Nobody wants to be in a situation where suddenly the lights are all upon you and you're being asked to explain everything you've been doing and where you've been. It's an incredibly distressing thing, and you've got a dangerous illness. It is a bad place to be. Of the 300 or so people who are now active with COVID, we can only send them our sympathy and encouragement that they get better. So I completely understand that people are distressed. That's why we provide the support we do through our public health teams and our wider health service.
Speaking of the illness,
why was the youth centre open during lockdown?
I don't know, Rich, for detail, but it's a childcare centre.
It is a childcare. Sorry, youth centre. Sorry.
You mentioned as well a couple of.
In Israel and Greece, they're testing second phase CD24, and they're showing that a 94%, severely.
Sounding like a question for Ben.
Well, Ben.
I'll do any more questions for me, then I'll go to Ben.
What are your thoughts on regional towns like Montague and Ballarat competing to get to that 80% vaccination rate? Is it a good thing that they're racing towards it, or?
Look, I think we're all desperate to get vaccinated. So we are. This is a race. Let's be very clear about it. We can see how serious this race is. It's not a race you want to win for a rosette or a lolly. This is a race to actually deal with this firestorm that's coming right up behind us. So we have to deal with it. All of us want to get hold of the vaccine as quickly as possible. All of us want to ensure that the vaccines we have available today are being utilised by the Victorians. There are slots available today for you to book, whether you're in Ballarat or whether in Baldwin. You please come forward and get that vaccination done. And the quicker we get the rest of our vaccines coming into Australia, the quicker we can put this nightmare behind us.
Have you had any progress with trying to get that staff member from the Kinder in Glenroy to get a test?
I've been too busy to worry about that one. We'll keep working with her.
Still refusing, as far as you're aware?
I haven't checked in the last 24 hours. I've had a few other things to worry about.
How disappointing is that, though, that now impacts dozens and dozens of people?
Look, I mean,
if not hundreds.
There are a number of things to be disappointed about today. The thing I'm really disappointed about today is that we're back in a world where we are literally on a knife edge about which way this outbreak is going to go. Right now, we are not heading in the right direction. The Premier could not have been clearer. Ben could not be clearer. This is not going in the way we want it to go. And the only thing we're looking at the moment is the other side of the Murray. That's the future in the next couple of weeks. And we can still hold this back. We still have it within us as a team, as Victorians, to get hold of this and to get it back under control. And even letting it go for a few days will make it so much harder to put it back under control. So I'm disappointed about that. I'm disappointed that we're all in this position. I'm disappointed that people have to knuckle down again and only leave home for 5 reasons. I'm disappointed that 10,000 people have to isolate, and more will have to isolate as we continue our contact tracing. In that context, one person not getting tested and locking some other people down is a minor irritation. I'd like her to get tested. I'd like those others to be not in complete lockdown, but ultimately the whole city is in this state at the moment, and we need to focus on the big picture.
Jerome, do we have the average number of days that each case was infectious in the community? I think the last time this was provided was on July 21. It was 1.
Not to hand, Mitch, no.
Is that something we can follow up on?
Sure, we can follow up on that.
Is there, just a question for Shepparton particularly,
Yeah.
is there enough vaccine for that community, particularly given its high Aboriginal population?
Yeah. Look, I think as Naomi Bromley said the other day, I think the vaccination work of our ACCHOs, our Aboriginal Controlled Health Organisations, has just been fantastic, and we're seeing a far greater take-up of vaccination amongst our Aboriginal and Torres Strait Islanders communities than we're seeing amongst the general population. That is fantastic news, and I'm so grateful to all the partners we have across our ACCHOs and our communities who are making that possible. We continue to ensure that vaccine is available. There is vaccine available in Goulburn Valley Health, and we will continue to make sure that community is supported as we face the challenges of the next few days.
Jerome, just with that case in Shepparton, do you have any more details? I mean, I think 3 schools might have been locked down
Yeah,
already,
so sorry, Rich, I've got a few more details. So we know the case is a man, I believe, in his 30s. His family are being tested this morning, so we should have results on them later on today. There are 2 children who attend St Mel's Primary School. That school has now been closed, and my thanks to the school leadership for acting so swiftly and making that possible. Obviously, we're now putting in a full response, so there's a significant testing response going in with Goulburn Valley Health. I would ask everybody in Shepparton, please look out for those exposure sites when they become available, and please can we focus on those people who are symptomatic and who have reasons to be concerned. So the local Bush Telegraph will work very quickly. I know what I'd like to avoid is a rush of the worried well to the testing station. We can do you tomorrow. I'd really like to focus today on making sure that those primary close contacts, as those exposure sites emerge, probably the community around St Mel's Primary School, that we get them tested first.
Has Shepparton Secondary College been affected as well?
Not to my knowledge, but I've been here for the last hour and a half.
And are there any suggestions at all on how the man might have picked it up?
Not at this stage. Obviously, contact tracing conversations started late last night, continuing on into this morning. We know he's a local man. I'm sure he's done all the right things. We will work out exactly what to get to the bottom of this as soon as we can.
In Broadmeadows, are we talking about there's the childcare centre, but then there's also a youth centre next door? Which one of these 13 cases connected?
My understanding is a childcare centre, but I'll get my team to confirm.
Sorry, did you say that man was a teacher at the school?
No.
Is he a teacher?
He's not a teacher.
Do you know what he does for work?
He's a parent.
Do you know what he does for work?
I do, but let's get a full download of what the case is about, and let's understand it a bit better before we start to go there.
Can we just ask a question of the professor, please?
Yes.
Can I ask, just now they've gone through phase 2 trials in Greece and Israel of CD24, and they've shown that there's a 95% success rate of people that are seriously ill from COVID coming out and Delta coming out after 3 or 4 days from hospital. Have you heard about it? Do you know anything about it?
Yeah, only some very scant details on that. I think there's a range of immunotherapies or treatments that affect the way the immune system responds to COVID-19. Right from the middle of last year, we were using dexamethasone, another immune modulating treatment, type of steroid treatment, which we saw, based on trials done in the United Kingdom, significantly reduce the mortality rate and the need for, that is, the number of people losing their lives and people who ended up needing to go to intensive care. There's antibody-based treatments like sotrovimab, that's Sotrovimab, sotrovimab, which the Australian government has been negotiating to procure and that the TGA are assessing. I don't have a lot of detail on the CD24 or the other some of the more emerging therapies. I think it's really important to remember we have effective treatments right now available. Dexamethasone, remdesivir, other treatments
This
we're
seems
using
to
right
be
now.
really the second phase shows that they've
Sure.
had 3 or 4 days really seriously ill and they've come out
Yep.
of hospital.
Sure. So I think look, it's all exciting. We want to have as many treatments as we possibly can for this illness. What I would strongly caution, though, is something we learned all through last year, is that you really have to wait for the full evidence before you get too excited about any new treatment, because some things that look great when it comes out as an abstract, or even worse, as a press release, when the full trial data become available, don't look quite so good. Not saying that about this case.
No,
I'm
this
just
was
saying.
trialled. This was trialled in hospitals in Israel.
Indeed. But we also know that initial releases of trial data pre-peer review, so before they've gone through the full process, can sometimes take a bit of time to filter through. But so many teams around the world working so hard to develop this evidence. So it's all exciting, not discounting it, but we do have to wait for the full data and for it to go through, obviously, regulatory approval.
And then can you just give us a bit of a feeling of how kids are coping with the Delta strain? Obviously, that huge percentage that are part of our active cases. How severe are their symptoms on average, that sort of thing?
Yeah. So on average, it is still the case that children have milder symptoms on average than do adults. And we know that the age distribution, so for every increasing decade of life, the likelihood of having severe illness increases. That said, as Jerome was saying, we have had children in hospital this year in Victoria because of severity of their symptoms.
Does their ability to pass it on change as well, different to an adult? Are they more infectious or less infectious? Is there any evidence around that?
And it's interesting. When we originally, so through the pandemic last year particularly, the strong perception was that children were not only less likely to get severe illness, but that they were not a major vehicle of transmission of COVID-19. That has certainly changed in the Delta variant era. We are certainly seeing increased transmission to and from children, and we are seeing the sort of attack rates that I was talking about before. So this has changed. We don't completely understand why that is so, but also picking up on the point that Premier made earlier, they're also not vaccinated. And one of the reasons, the good side of the story, is that more senior Victorians are much less represented in our data, including in severe illness in hospital, but for the very reason that a large proportion have now been vaccinated.
Just on what things might look like at 70%, this suggested New South Wales plan mentions things like hospitality opening for just sitting down and retail opening for people that are fully vaccinated. Is your public health team working on a similar kind of plan for 70% here? And do you think it could include things like that?
Yeah. So, look, certainly the National Cabinet plan around sort of the progression towards 70% and 80% includes a range of different settings once we reach those thresholds. It is certainly the case that the higher the proportion of people in the community who are vaccinated, the greater freedom we'll all enjoy. Really, I guess from the public health perspective, our focus is the idea that with those sort of levels of complete vaccination in the community, that we will be able to not go through the whole of system shutdowns like lockdowns as we are at the moment. That's really that fundamental issue, but we will still have to have localised responses. It is not the case that we won't have to, for instance, close businesses or have restrictions in place, particularly if there are cases in a given community. And the final point I would make is when we look at the entire population coverage of 70% or 80%, the real concern that I have is that we will have sections of the community who are under-vaccinated. And if you've got significant pockets, whether that's geographically or particular groups in the community who have, for whatever reason, lower levels of immunity, that's also something we're going to have to consider from a public health and from a health system response. And it's one of the reasons why the engagement teams in the Department of Health and in councils and health services are working so hard to try and ensure that if people do have reduced access for whatever reason to vaccination, that access is boosted up.
All done. Professor, I know... Sorry, I've got one just quickly for you.
Okay.
I know the Premier wouldn't expand on this, but people at home are understandably worried. How much tougher can restrictions actually get from here? And can you give us any insight into what you're actually looking at?
So, honestly, okay, thank you.
As the Premier indicated, as Jerome's indicated, as Ben's indicated, we've got nothing to announce today on that. But as we've made clear, nothing is on or off the table. We're not ruling things in or out today. We'll call in on all Victorians to step up and see this one through. Julia, you have a question?
Yes, please. So a man alleged to have impersonated an authorised officer to coerce sex from a woman in isolation was working for a business contracted by the health department. What checks were done on people handling the sensitive contact tracing data?
I understand this matter is actively before Victoria Police and the courts, and it would not be appropriate to make any comment. All done? Mm-hmm. Thanks, everyone.
Please. Can I steal them? I'm freezing. Thank you.
All good. All good. No, I think how we had it set up was a little bit.